This is a presentation on Microsoft by Christina Buckley, Gwendolyn Cody, Michael Lavelle, and Catherine Tamburo. Microsoft is a $60 billion company founded in 1975 by Bill Gates. We are one of the largest IT companies in the world. We develop, produce, certify, and support some of the world's most widely used software products. Microsoft is a globally recognized brand. In 2007, we were ranked number 2 in Businessweek's global brand rankings. Microsoft has been in the health IT industry since 1996. But a lot has changed since 1996. Our future strategy in the health IT marketplace needs to reflect the Microsoft of today and the technology, scientific capabilities, and policies that surround us. Here, we will present our future strategy, which is based on Microsoft's assumptions, drivers, current strategy, and capabilities. In forming our strategic plan, we, Microsoft, make some assumptions about the health IT industry in which we compete. Firstly, we assume all health IT consumers, including patients and healthcare providers, will demand interoperability. We also assume that although the number of health IT vendors has increased in the last decade, at a point in the near future, that number will begin to decrease as some companies will gain market share. Thirdly, we assume the health IT industry is significantly affected by government regulations and provider incentives, and that the regulations and incentives that have already been proposed will be carried out as planned. A specific example is the Centers for Medicare and Medicaid Services Meaningful Use Policy. Meaningful Use Policy provides hospitals and healthcare providers with a set of financial incentives to adopt electronic health records and use them in a meaningful way. There are more than 20 objectives or measures that must be met in order for a provider or hospital to be deemed a meaningful EHR user. The incentives will begin in 2011, and in 2012, CMS proposes requiring the direct submission of clinical quality measures to CMS or to the states for Medicaid through certified EHR technology. Finally, we assume that healthcare organizations and providers influenced by policies like meaningful use will constitute the majority of the demand for health IT. The consumer is driving the creation of medical databases where the person is in charge of his or her own personal health information. For example, Microsoft Health Vault allows health and fitness data to be uploaded from multiple medical devices in order to comprise a health portfolio that can be shared between patient and provider. As mentioned before, Microsoft would like to emerge as a global leader in health information technology, and interoperability is the key to do just that. Microsoft is continually working to integrate with other health information systems, because the day one health system cannot integrate with the other is the day that health system becomes obsolete. Also, Microsoft is sticking to its brand by creating innovative solutions using digital media that will improve the efficiency of the health information systems. At a press briefing in Washington, D.C., Peter Newport, Corporate Vice President of Microsoft's Health Solutions Group, provided this context. Health Vault is the three things, he said. It's a new, private search experience designed to help the user navigate the rich and complete information that exists out there on the web to help them find the information and the services that are relevant to them. Next, it's a private and secure shared data repository and online service for the family manager to collect, store, gather, and share their health information. Last is the Health Vault Connection Center, a client application that allows people to collect and share health information from plug-and-play personal home health devices. The goal, he said, is to empower the family health manager, who in many cases is the mother. Microsoft also has Hospital Amalga family products. Microsoft Amalga is a new version of the product formerly known as Exixi and is part of a new software category called Unified Intelligent Systems, designed for hospitals and health systems that have invested in a diverse set of IT solutions. Without replacing current systems, it offers an innovative way to capture, consolidate, store, access, and quickly present data. Microsoft Amalga Hospital Information Systems is a new version of the product previously called Hospital 2000. Amalga HIS is a fully integrated hospital information system designed for developing and emerging markets. It is built around an EMR with complete patient and bed management, laboratory, pharmacy, radiology information system, picture and archive, communication system, pathology, financial accounting, materials management, and human resource systems. Amalga, RIS/PACS, is a new version of the product formerly known as GCS Amalga. It is available as a standalone system as well as an integrated component of Amalga HIS. The integrated architecture means that a radiologist can use a single application to manipulate and study images and access the patient's medical record. The workstation interface includes support for predefined templates, an intuitive report editor, and voice recognition capabilities. Like Amalga HIS, this product is targeted at healthcare providers in countries outside the US. Health Vault is free. Doctors and hospitals do not have to invest in new equipment to use it. Microsoft is also partnering with medical record software vendors such as Allscripts. Doctors using EMR software can easily send files over the web to Health Vault. Doctors who do not have EMR software can securely fax data to their patients' Health Vault files. One promising aspect from Microsoft's Health Vault is that the company was able to cite more than 40 partners, including Allscripts, which provide EMR systems, Healthways, which provides wellness and disease prevention services, and New York Presbyterian Hospital. Other partners include health device makers, which will import Health Vault information. Working to Microsoft's advantage is that most medical information is already in digital form. Terabytes of electronic healthcare data are scattered throughout the U.S. on the servers of pharmacies, insurers, hospitals, and many physicians' offices. Also, Microsoft has no debt to pay off. Microsoft will not need to borrow money or get out of any debt in order to start a new adventure. Everyone knows the name Microsoft and the success that the company has. The strength will attract people to buy the Microsoft system when being compared to other, lesser-known brands. However, critics believe that the government will have to participate in some way to convince consumers that web-based health information is as secure as online banking. One issue for Health Vault is that they are not covered under HIPAA, Health Insurance Portability and Accountability Act's regulations. Also, Northwestern Medical Faculty Foundation CIO Dale Sanders said, "I believe Microsoft is missing an opportunity to establish itself as a forward-thinking leader in a new vertical by offering a traditional legacy licensing model for Amalga. I've been encouraging them to offer a utility pay-as-you-consume model, which I believe would ensure more, not fewer consumers. The licensing model they are offering now is very typical of transaction systems, big upfront fees with smaller multi-year commitments. However, Amalga is more akin to a business intelligence tool. Therefore, predicting the total adoption rate is very, very difficult." In the future, our strategy will be to focus primarily on our Amalga family of products. We believe there is more potential for profitability with Amalga than with Health Vault, especially as hospitals become influenced by CMS's meaningful use incentives. First, we will change the pricing scheme of Amalga to a pay-per-year model. Second, we intend to maintain Amalga's superior interoperability. Lastly, we will create and market a most meaningful use task force for all Amalga clients.